The Presbyterian General Hospital, Acha Tugi, said to be the mother hospital of the PCC, will henceforth be better cleaned, lighted and secured thanks to a donation made to the hospital by an illustrious son of Nja who saw need to give back to the hospital where he was born over 40 years ago.
This is where I was born, and I've reflected, like I made in my speech, I reflected why I haven't done something before now. So I think there is time for everything. That is why today I had to come with these items and then hand it over to the hospital. There are several items ranging from security cameras, soap, you have vuvuzelas, buckets and trash cans and a whole lot. For me, giving back to the hospital, I feel proud because hospitals are social centers where you have people who are suffering, and we are not giving back because we have a lot. And the motivation comes from the fact that I have always been sharing. From my childhood upbringing, I always have the spirit of sharing. We need to inculcate that attitude of sharing, because like I often say in some gatherings that if you have 1,000 friends, you don't share with someone, and you are hoping to have 1 million to share, you will never share. So when you have 1,000 friends and you share, when you have 1 million, you will still be able to share with others. And what motivates me is that I feel happy when people are happy.
The handing over of the items took place on Friday, 27th September 2024. Present to receive the items, as mentioned by the donor, comprised of security cameras, trash cans, buckets, moppers, cubic and powder soap, toilet tissue amongst others, were the hospital officials, patients and the beneficiary population.
I want to thank him for this wonderful gesture, this motivation that he's just done to the nurses. I was surprised that what I saw years ago as equipment, like the X-ray and all those important equipment are still there intact. It's really a pleasure. I want to give thanks to Victor and with that wonderful initiative that he's tried to bring, that the children born in Acha Hospital should come into an association so that we can come in our own little way to support this humanitarian activity. So some of us to be witnesses to this wonderful occasion, we also see how we can spread the message. This is a message that we need to share and share and share and say Acha Tugi Hospital is still strong and kicking alive with a dynamic staff, good manager, wonderful doctors. These guys are sacrificing at this material moment. These are the people that the church should look at and see that they should actually also motivate them for being resilient.
I like where Mr. Victor he can jump the hospital, the doctor, they do all staff, they do work. We thank them all and we invite them, other people, they want different places. May they come, and other will kill them when they be so when they do work of small things, may they can join hands. We love this hospital, they may grow as how we be before. So we like and plenty at the blood. For my people, can do some fine thing for hospital, for help people when they are sick. Not only doctors, but for sick people, they would encourage the doctors, they make them work hard, make them work there for their back.
Informed of the gesture, the Synod office in Boya, through the PCC's Secretary of Health Services, sent a special letter of congratulation and appreciation to the donor.
Mr. Louis Victor Teche, JSL, a letter of appreciation. Accept greetings from the Health Services Secretariat of the Presbyterian Church in Cameroon. We have followed very keenly with the administration of our dear Acha Tugi Hospital. You were benevolent gestures in supporting the healing ministry of the church by improving on lighting system of the hospital to ensure security to the church's property, patients, and staff of the facility. Providing sanitary tools to improve hygiene and sanitation of the hospital. I have been directed by the moderator of the Presbyterian Church in Cameroon, the PCC, to appreciate all the effort you are putting to support the mission in the Meta Presbytery, particularly in Acha Tugi Hospital. Thank you for your cooperation. Yours sincerely, Dr. Fidelis Bango, Health Services Secretary, PCC.
The Presbyterian General Hospital, Acha Tugi, is one of the oldest and has given birth to several Acha annexes in and out of the Northwest region. The hospital during the Anglophone crisis period nearly shut down, but the church, the population and other stakeholders fought hard to make sure such doesn't happen, and today, though it's now a shadow of its past glories, at least it's still on, with hopes that it will be revived.
If you are carrying messages and going forward, try to tell the people that Acha Tugi is still alive and we are still operating on full capacity. Acha is the highest investment that the Presbyterian Church is having in the whole of Momo.
To the donor, his desire is to see others, especially those who were born at the hospital and patients that have been treated at the hospital, come back and say thank you in kind through such similar gestures like he has done.
The call I'm making is that I know we have well-to-do brothers, sisters, fathers and mothers, because I'm not giving because I have much. I told you, I don't even have compared to what others have. I don't even have. For me, it's just to share that matters for me, to always share. So what I'm calling upon them is that they should not abandon this hospital. Most of us have passed through this hospital. We have passed the corridors of this hospital. We're born here. We've been treated here. Not only the people from Meta, people from Oshe, Batibo, Widikum, the Bororos, they come here. So I think I just call on them to emulate this example, even though some must have done it before, but let's go ahead with this because it's very important to save a human life. The items will bring great relief to the patients here. I also want to call on the mayor, to the Dengue Council, the mayor, if he can really lend his support to this hospital because it has really been, I call it the shadow of itself. Yeah, most people don't even know if it's still functional. But thank God the doctor raised the point that the hospital is in full gear. So we should really come back and support the hospital.
The items were committed to God for blessings before usage, at the end of which songs of appreciation were sung by the hospital staff to their august guest. Last month, Teche Victor had opened and inaugurated a cold store at Sanyere to bring frozen fish and other goods of basic necessity closer to the people of his native Nja, Acha Tugi, Kop, Tudik, Ngokwen, Chup and environs.
Thank you, brother. Oh, thank you, brother. We are saying thank you, brother. Thank you, brother.